The Trump administration is taking another major step to overhaul America's health system. The CDC is reducing the number of childhood vaccinations it recommends from 17 to 11. The changes affect shots for illnesses ranging from the flu to COVID to RSV. MS Now reporter Nick McCool has more on the new policy and the public health experts who are speaking out.
This morning, the Trump administration injecting major change into childhood vaccines. The Centers for Disease Control reducing the number recommended for all kids from 17 to 11. The alarm from public health experts was immediate.
What they have done is sown a lot of uncertainty, doubt, fear, and so a lot of parents are going to be confused.
The CDC guidelines now say parents should consult with a doctor before shots for the flu and rotavirus. And they say vaccines for illnesses like meningococcal disease, hepatitis A and B, and RSV should only be given to children and babies in high-risk groups. The agency still recommends some vaccines for all kids, like MMR shots and immunizations against polio and chickenpox. HHS Deputy Jim O'Neill discussing the changes.
Many parents are concerned that they're injecting their young, innocent children with a lot of medicines. They're not sure about the risks and benefits of all these. And many people have been asking questions.
Health Secretary Robert F. Kennedy Jr. says the schedule was updated after reviewing the vaccination plans of other developed nations. President Trump posting this image on Truth Social, showing an American child appearing unhappy with how many shots he receives compared to a baby overseas. HHS citing Denmark as an example of a European nation modeling fewer mandated vaccines. But critics say it's not an accurate comparison.
Denmark is a country that has 2% of the American population, universal free health care, and it tracks every child. We are nowhere near that. We're much more disorganized. Most countries like Canada, like France, England, give between 13 and 16 vaccines to their children, and we are closer or more like them than we are like Denmark.
The federal government cannot mandate state childhood vaccination policies, but its guidance still influences state policy. But in this case, the agency bypassed input from its own advisory committee on immunization practices, which is designed to weigh in on these issues.
Americans have lost faith in CDC, and we need to restore that faith. And we're going to do that by telling the truth and not through propaganda, by making them understand that everything that we say is true, that we're going to tell them what we know.
A lot of children will die. This last year, we had 288 flu deaths in the United States. 80% of them were among unvaccinated children. What I'm really concerned about is we're not giving our children a fair shake. We're going to make their lives much more precarious for no reason.
Dr. Emanuel told us the comparison to other European countries also doesn't work because there's more trust in the government in many of those places, and medical professionals are more likely to go out and encourage vaccination. Back here in the U.S., vaccination rates are declining, and cases of some preventable diseases like measles and whooping cough have increased. America could lose its measles elimination status by the end of the month, which has been maintained for more than 2 decades. Back to you.
MS Now's Nick McCool with that report. Thanks, Nick. Let's bring in now MS Now medical analyst Dr. Vin Gupta. So, Dr. Gupta, let's go through some of this. It's a pretty remarkable shift in the childhood vaccines. Let's just start with what alarms you the most? Because I know there's so many in the medical community that have expressed real concern.
Jonathan, good morning. Number one is that these vaccine recommendations across the United States, across the world, are based on local disease burden. As was said in the package, the U.S. simply just has a different disease burden profile than Denmark, than the United Kingdom, than other countries. You can't import another country's vaccine schedule and recommendations for children and not also import their healthcare system and their realities. And I think, Jonathan, that's number one. Rotavirus, take rotavirus. This is now part of the shared decision-making paradigm that CDC has announced yesterday. Before routine vaccination, we had up to 70,000 cases that resulted in hospitalization from rotavirus. And now we're saying that this is going to be voluntary, up to shared clinical decision making. It's not a firm recommendation. It doesn't make sense based on what we've seen in the past.
So, Dr. Gupta, let's go through some of the critiques, one of which being offered is that if these vaccines were truly necessary, Denmark would use them too. Your thoughts?
Yeah, well, vaccines in the United States compensate for structural gaps, not biological differences. So, number one, it's important to recognize, as was said in the tee-up, Denmark has universal health care, has near universal vaccine uptake, has paid parental leave, near zero childhood poverty, near zero childhood uninsured healthcare access. We have none of those here in the United States at scale. As a result, Denmark does not have issues with flu. It doesn't have the 300 flu deaths that we see here in the United States. By the way, we're in the worst flu season, we think, Jonathan, in decades. We're seeing 40 surges in 45 states. We're seeing measles here, lose elimination status, nearly lose elimination status here in the United States. These are not problems that exist in Denmark. So what exists for them and works for them just won't work for us. By the way, they have 2% of our population. Very different challenges.
Yeah, Dr. Gupta, let's combine actually a pair of these critiques into one question. The idea that the U.S. schedule is overly aggressive compared to Europe, and then twinned with the idea, this is the argument that others make, that changing the schedule improves trust by reducing the number of shots.
That's right. And so, this is something that the president actually tweeted, that image that was shown in the package. And there's a big problem here. First of all, we don't get 72 shots here in the United States. That was complete misrepresentation. We give shots, annual shots through 18 that result in protection to about 24 diseases, which is similar by the age of 18 to what we see in the United Kingdom, to what we see in Spain, to other European countries. So one, there isn't a big gap between what we do here, despite the fact that we're heterogeneous, despite the fact that we have different healthcare challenges and what we're seeing across the EU. So that's one. This is not about number of shots. We do not give 4 times the number of shots. That was misleading. That was a wrong image put out by the president. When it comes to trust and transparency, simply decreasing the number of shots here, which is what they're recommending, that's not what any medical society, Jonathan, is recommending we do. There's a reason why the American Academy of Pediatrics, the American Association of Family Physicians, is saying that this is the wrong move right as we enter COVID or cold and flu season, with COVID and flu rates very high. We're seeing measles again spiking. This is not the time for that, because there's only so much you can do in that 15-minute visit with your pediatrician. They already have enough to contend with. Now we're saying, hey, here's one more thing to talk about. It's not the right move.
MS Now medical analyst Dr. Vin Gupta, thank you very much. And you can learn more about the changes to the nation's vaccine recommendations by reading Dr. Gupta's new piece. That will be in today's edition of our newsletter, The T. Just scan the QR code on your screen right now to subscribe. It'll be delivered to your inbox. We'll be right back with much more Morning Joe.